Hi, I'm Dr. Greg Chappelle. Just wanted to talk to you a little bit about the health crisis we've got in this country. I mean, people are getting sicker and sicker. The medical costs are going up in the double digits every year. And we look at insurance. People are very reliant on insurance to take care of their health care needs. And the problem is that's a dead-end street. Deductibles and copays are going up. What they're covering is going down. It's just, Medicare has said that within the next 5 to 9 years, by 2019, that they're going to be insolvent if the present trend in healthcare doesn't change. And it's just the way the thing's going, it's like a snowball rolling down a hill. I don't see it changing that much. And obviously the federal government's not going to help us because they're trying to figure out how to get more services to more people as opposed to trying to figure out how to get more people less sick. So I hate to be the harbinger of bad news, but it's like you got this tsunami in the distance coming and you can see it, and we just can't stick our heads in the sand and ignore this whole thing. We've got to start to take action as individuals and communities and so forth to start to have an impact on the healthcare in this country. Otherwise it's going to bankrupt the country and we're going to have more and more people sick and dying, and it's just not a good scenario. Harvard did a study and said that 50% of all personal bankruptcies are due to health crises that people could not afford, and 70% of those people had insurance. You know, you look back at the statistics over the years of how we're doing with our healthcare model in this country, and you look at Dr. Barbara Starfield in the mid-90s did a study, and she's from Johns Hopkins University, and she started taking a look at the efficacy or how effective medical treatments are for taking care of the population, and found that basically when she added up all the different things like reactions to medications, people dying from surgery, mistakes that are made and so forth, they came up that medical treatments came up as the third leading cause of death in the United States. And then some other sources took a look at it and they reworked the statistics, and some other medical doctors, and came up that it was actually about the #1 cause. Over 780-some thousand people die of medical treatments every year. And I'm not here to bash medicine. Basically what I'm saying is that we live in a very reactive society. We wait till things break down and try to deal with them. And sometimes the treatments can cause more problems than actually what they're fixing. So, and then Journal of American Medical Association in January of 2010, last year, came up with a very similar type of things, that we're not doing really well. We're basically breaking even with how many people we're helping and how many we're killing. And that doesn't even count the millions of people that are hospitalized from different treatment processes. Then we look at the World Health Organization and their Health Report 2000, and they state that the United States ranks 37th in the world out of 190 member nations, 37th insofar as our health performance. We rank like 49th in life expectancy. I mean, this doesn't make any sense. Look at the resources that we have in this country. We have the doctors and the hospitals and the teaching facilities and the drug manufacturers and so forth. You would think that we would have the best health care in the world, and we really don't. We're way down the line. So when we take a look at the emphasis on treatments and being in a reactive type of thing, drugs haven't worked. Otherwise, why do we have so many sick people out there? The sickness rates just keep accelerating over time. The people with asthma and the kids with asthma and allergies and autism rates are going through the ceiling. You would think that if the newer and better drugs were working, that these rates would be going down, and they're not. They keep accelerating. You know, basically drugs are very good at stabilizing conditions in a crisis situation when people let themselves go too far. But then we need to try to change our lifestyle so we can build health back into the body, so that we don't keep recreating the same thing over and over and over, and all we're doing is trying to take things and medications to try to cover up the effects, as opposed to finding the underlying cause, which about 85% of the time is lifestyle choices, how you're eating, how you're moving, how you're thinking, and so forth. And if we can have an impact on those different elements, we can recreate a healthier body. In other videos I've talked about how they say that the body replaces itself. About 98% of the atoms of the body are new every 3 months. So you're constantly recreating this dynamic system in here. Old cells die off, new ones are formed. How are we forming them? Are we forming them in a more healthy manner or in a less healthy manner? And I think you would agree that most people out there in their lifestyle choices, they're going downhill. Why do we see so much sickness and disease out there? I mean, what do most people die of? Do they die of old age? No, primarily most people die of chronic diseases, and as I said, 85% of those are due to lifestyle issues. You know, and you look at the kids. I mean, we've got to start with the kids and start bringing up healthier generations behind us so we can have a huge impact on this devastating, deteriorating healthcare process in our country. Actually, the present healthcare system is really not a healthcare system, it's a sickness and disease care system. We got to get our heads wrapped around a new model of actually preventative health and what it takes to do that. I mean, the kids are getting vaccinated, but they got 50-some vaccinations, and I don't want to get into vaccinations, that's a whole different story. But basically, you look at the vaccinations and what do they have in them? They've got formaldehyde, is what we call the adjuvants, the carriers that carry the active ingredients. Ethylene glycol, which is basically antifreeze. We have formaldehyde, mercury. These things are very, very detrimental to the system when you start to put accumulating amounts of those into the body over time. You know, the 25 years that I've been in practice, I've seen stress levels going up, and I'm not talking about just emotional stress. We look at the physical stresses, and it's a very sedentary society. We sit around and the computers and the Game Boys and all of the video things that we sit and watch. We're not moving enough. The kids are not moving enough. We got to get out and move the body to stimulate the brain. They say now that the movement is a nutrient to the brain. It fires the system up, like taking dimmer switches and opening them up and allowing the system to come back online and function like it should, so then it can tell the body how to function at its optimum state. But basically, stresses are going up. So we have the physical stresses, we have the biochemical, the artificial sweeteners, and the food additives, and the things that they're putting in there. Most of the junk that we eat, it's just stressing our system out so much. And then we got the mental emotional stresses. Obviously, the world situation. We have the economy, and people just going. I see families trying to do more and more things with their kids and so forth. And it's just, there's got to be some place to stop and level this off. Watch who you're hanging around with. Are they negative? Are they positive? What kind of thoughts do you have going on in the internal wheel in your own brain? Are they positive thoughts? Are they negative? So we start to look at these, and as I said, they've been increasing. So we need to come up with a vision of where we want to be, and sit down and get a clear vision of what you see your health looking like in the future. Or do you just want to let it go until it deteriorates and you wind up with some sickness and disease process like the vast majority of Americans? So come up with a vision, set an action plan, get some strategies as to where you want to go. You want some help with that? Give us a call and we can help you with that. Get on the internet and look up different things that you can do. And then you got to take action. You got to make it happen. Take some baby steps. Don't try to tackle too much at one time. Little stuff, little by little, day by day, and set yourself some very doable, attainable goals that you can accomplish. Reward yourself for being there. Buy yourself some tickets to a concert or something like that, or buy yourself a little piece of bling, and start recreating yourself in a healthier and healthier manner. And over time, as we as individuals take responsibility, we start to create ourselves healthier, we start to get healthier families, healthier communities, and eventually we can change this world one step at a time. So thanks for joining me. I'm Dr. Greg Chappell.